Good day, we are Group 2 and we will be presenting our case presentation on urinary tract infection and kidney infection. So first we go over the physiology or the normal function of the urinary system. So the urinary system is also called renal system, and its function is to excrete waste from the blood or to remove waste from the body. And next we go over with the urinary tract infection overview. So a urinary tract infection is an infection in any part of the urinary system. So this includes the kidneys, the ureters, the bladder, and the urethra. So the infection occurs from the skin, and then it enters the urethra and into the urinary tract, which causes the infection. One type of urinary tract infection is the kidney infection, or a medical term is the pyelonephritis. So it occurs when the bacteria from other parts of the urinary tract travels to the kidneys and infects it. So UTIs or urinary tract infections are most common in women because they have shorter urethras compared to males. Next, we have the risk factors. So here we have a previous UTIs, sexual activity changes in the bacteria that lives inside the vagina or vaginal flora. So infection occurs when there is a change in the vaginal flora. For example, menopause in the use of spermicides can cause the bacterial changes. Another risk factor is pregnancy age. Older adults and young children are more likely to get urinary tract infections. Structural problems in the urinary tract can also be a risk factor, such as enlarged prostate. Poor hygiene, for example, can cause a risk factor. And in children who are potty training, they are also considered a risk. So next, we have the pathophysiology to be discussed by my group mate.
Okay, I will start with state the pathophysiology of urinary tract infection and kidney infection. First is the precipitating factors. The precipitating factors are sexual activity, birth control, poor hygiene, and pregnancy, constipation, and iad mo pa dito yung pagpipigil ng ating bowel. Another one is the predisposing factors, which is diabetes mellitus, impaired voiding or bladder, genitourinary malfunction, and prostatic hypertrophy. These are the predisposing and precipitating factor which led to the contamination in the urinary tract infection. If there is contamination, first it will contaminate the urethra and then the bladder. Why? Because the urethra is the first one to be contaminated because there is a lot of bacteria there. So what happened is there is colonization in the urethra and bladder. If you say colonization, the bacteria there, based on the predisposing and precipitating, the bacteria there gain the upper hand against the mga immune system ng ating body. And if there is the bacteria against the upper hand and there is an inflammatory response, this inflammatory response leads to inflammation. So may inflammation na doon kasi nga may infection. And then other next din is the body will produce what we call the neutrophils, which will kill the bacteria, but the bacteria grows too strong. That's why there is the bacteria multiply. So na-invade na nila yung ating neutrophil. So the neutrophil infiltration leads to more, yung mas lumakas pa yung mga bacteria dun sa ating urethra and bladder, which cause the cystitis and the urethritis. When you say cystitis, it's the inflammation of the bladder, and urethritis is the inflammation of the urethra. And if left untreated, pag hindi pa ito inaagapan, is pinabayaan siya, it can cause, this bacteria can go to the upper urinary tract infection, which there we have the kidney. So if napabayaan ito, is magpupunta siya sa kidney, and then makokontaminate yung kidney at magkakaroon tayo ng pyelonephritis, which is the inflammation of kidney. So pag napabayaan ulit, hindi pa inaagapan yung infection in the kidney, it will go to the bloodstream. So kasi dumadalo yung blood natin from the artery to the kidney para malinisan, and if yung kidney mo is infected na, so pupunta yung infection sa blood causing the bacteremia na magkakos siya ng septic shock. So kapag naging grabe ng ganito is hindi na to basta-basta maagapan. So that's the pathophysiology of urinary tract infection.
So next is we have the clinical manifestation. We have the fever and chills because infection already spread in the urinary tract or in the kidney. A burning feeling or pain when urinating because the lining of the urinary tract or the bladder is already irritated. Having to urinate often or yung madalas na paghihingo, a strong lasting urge to urinate, or yung feeling na you cannot control na maihi. But as you urinate, konti lang yung lumalabas. This is because the urethra is swelling that hinders the urine to pass. Another manifestation is back, side, or groin pain. So, upper UTI can cause intense back pain, specifically lower back and groin, as the infection reaches the kidneys. And back pain comes with two other symptoms, which are the fever and vomiting. That is why nausea and vomiting is included in the clinical manifestation. Another symptom is blood or pus in the urine, or the pyuria, which indicates infection of the urinary system. And this is the most common cause of UTI. So urine is also cloudy and foul smelling. Another common symptoms of UTIs is belly pain or abdominal pain due to the irritation of the walls of the bladder. Also, bacteria causing the infection can also affect abdomen, specifically lower abdomen. Thus, you will experience a lot of pressure and pain. Okay, so now let's move on to the diagnostic tests. So first is the urinalysis. So for the OTC dipsticks or the over-the-counter dipsticks, kasama na siya sa urinalysis or ginagamit na siya for the urinalysis. Urinalysis, it can be used to detect infections, kidney problems, and even help screen for the diabetes. These tests look at the appearance, the content, and the concentration of the sample urine that is acquired from the patient. So the patient is given a sterile container for a clean cut urine sample. So this is performed by first washing the genital area with supplied antiseptic wipe, and then instruct the patient to do the midstream catch. And this method helps prevent bacteria on the genitals from affecting the test results. So the urine sample is tested for bacteria in the doctor's office, and the specimen is examined for specific bacteria in the laboratory. So if you are experiencing symptoms and the initial lab results are positive, your doctor may prescribe the medication at that time. Next is the home test kits for UTI, or ito na yung over-the-counter dipsticks that is used to test for urinary tract infection. It can be purchased at a local pharmacy without prescription, over the counter. So this typically includes treated plastic strips or dipsticks that you hold in your urine stream or dip into a urine sample in a supplied container. If your urine tests positive for a bacterial infection, an area on the dipstick changes color. So meron yung guide or instruction sa packaging ng dipstick, and meron din dun yung color, kung anong color yung lalabas sa dipstick in case by infection sa urine sample. So since this is a home testing kits, and if the results indicate that you may have a UTI, you should contact your doctor for treatment. Next is the urine culture, or also known as a bacteria culture test. It is frequently used as a follow-up to urinalysis. So para siyang follow-up test for the urinalysis kung merong yung lab is na-detect siya na may abnormalities. This test can identify and quantify specific bacteria, which helps in the selection of the most effective antibiotic to use in treatment. So this test, na-identify niya and naka-quantify niya kung anong specific bacteria yung nakuha sa urine sample ng patient, and malalaman ko or mabibigyan siya ng effective antibiotic na tama sa kanya for her treatment.
Okay, so for further testing also under the diagnostic test, it is also needed for cytoscopy. And this cytoscopy is performed to diagnose the cause of the recurrent UTI. So it helps the doctor look inside the bladder for sign of infection, including also the irritation or cause of irritation. And cytoscopy can also help the doctor to identify the cause or of symptoms or infection, such as stones, obstructions, or lesions in the bladder. And another thing is the ultrasound. So if you have recurrent, frequent urinary tract infections, your doctor may order an ultrasound to check the kidneys and bladder for irregularities that may require the treatment. And this test is usually uses sound waves to create images of structures inside the body. And the last thing for further testing is the CT scan. Your doctor may perform a CT scan to provide clear, three-dimensional images of the urinary tract. And this test can help in detecting also infections, stones, cysts, or even tumors. And in a CT scan, a series of X-rays of the urinary tract is taken and images are sent to the computer for monitoring review.
For the management, antibiotics are the medications that can cure urinary tract infections. Many different antibiotics can treat a urinary tract infection, but it depends on patient history, the type of the UTI, and the history of previous UTIs. Administered medication prescribed by the doctor, such as the amoxicillin, ceftriaxone, cephalexin, ciprofloxacin, fosfomycin, levofloxacin, nitrofurantoin, trimethoprim, and the antispasmodic, which is the antimuscarinic medication like teltorelin, flovocate, and oxybutynin, as well as the beta-3 adrenergic agonists like mirabegron. If the patient is still discomfort, the doctor may describe an analgesic such as the penazopyridine, which is for pain relief medication.
So, here are the management or the nursing interventions for UTI. So, we're going to instruct the client to increase fluid intake para mailabas niya yung bacteria. And then monitor vital signs, urine output, and pain levels regularly to detect any changes. And then we're going to encourage the patient to void frequently every 2 to 3 hours or soon as possible after sexual intercourse para mailabas niya yung bacteria. And then we're going to instruct client to avoid using spermicide and diaphragm birth control dahil pwede niya ma-increase yung risk ng UTI. And we're going to instruct the client to avoid urinary irritants such as cola, tea, coffee, and alcohol. And then some nursing interventions are we're going to encourage the patient to take prescribed medication as ordered by the doctor, continuously assess the color, odor, and clarity of the patient's urine to detect any improvements or worsening of the infection. And then we're going to provide information, or we're going to health educate the patient on the importance of good hygiene, such as wiping from front to back and avoid irritants like perfumed soaps. So here are the our reference for our here are our reference for our case study. And then thank you for listening, and this ends our report.